Hi, my name is Gina Adams, and my presentation is on child abuse and neglect. What is child abuse and what is neglect? According to the Federal Child Abuse Prevention and Treatment Act, child abuse is described as any recent act or failure on the part of a parent or caretaker which results in the death, serious physical or emotional harm, sex abuse, or exploitation. There are several types of child abuse. There's physical abuse, which results in physical harm, such as minor bruises or serious uh, fractures. There's neglect, and that is the failure of the parent or the guardian to care for or provide the child's basic needs. There's sexual abuse that includes activities by the parent or caregiver, which includes fondling of the genitalia, penetration, incest, and rape. There's emotional abuse, in which there is impairment of a child's emotional development or sense of self-worth. There's also abandonment, which the child is where the parent is not in the child's life. Um, there's substance abuse, and this usually pertains to women that are partaking in substance abuse when they're pregnant and or manufacturing drugs around the child, or selling drugs around the child. Um, there is a difference between child abuse and racial and urban. Just to give you an example, there's so much information on my presentation, I'm going to try to condense it down. But between rural and versus urban, for physical neglect, the rural is 33% of child abuse, and urban is 19. Sexual abuse is 24%. Urban is 23. Domestic violence can be in rural is 40%, but in urban it's 45. So there is a little bit of different fluctuation there. For supervisory neglect, it's 23 for rural and 26 for urban. So there's a difference there also. You want to make sure that some of the key findings is that 1/4 of all cases investigated by CPS are substantiated, which is important to make sure that it can be processed properly. Older children in rural places are more likely to have a reported case of child abuse that is substantiated at 35%, but in the rural area it's 23% in urban. So again, that is 35% in rural and 23 in urban. Children in urban areas are where caregivers are either experiencing activities of domestic violence or having cognitive impairment are more likely to have a case of substantiated charges of child abuse against them. There are some other factors for caregivers, risk factors. Caregivers that are in the rural area that are experience drugs is 55%, but in the urban it's 43%. Some caregiver risk factors are also alcohol. In the rural area there's 65%, and in urban is 53%. For members that have caregivers that have been arrested within a 12-month period, rural area is 49, urban is 35. Also, those who have had prior experiences is 32, and in urban is 34. So there is some fluctuation there. Parents that are living in the rural area experience different levels of stress. Families that live in rural areas have been reported for child abuse to CPS are more likely to than those in the urban areas that are experiencing high family stress due to financial situations. Most caregivers, more than 60%, report low social support in rural areas. In rural areas, single parents and stress um, are 3 times higher reported to CPS are having trouble meeting their basic financial needs compared to just over 5% for urban families reported to CPS. Um, I also did a little research on how discipline is um, done in India, which I found was very interesting because um, in India, it's investigated that practices of middle class professionals in India found that 57% engage in normal corporal punishment, such as spankings and slaps or your basic discipline. But there is also in the rural area of 42% that there is some abusive discipline, which includes kicking, hitting, biting, and beating a child. In the rural area of India, you can also experience some poor nutrition, poor health care, poor education. Um, there's opportunities for kidnapping and forced prostitution. Also in India, there's also a community level that they experience the same social isolations and lack of support and social changes. In India, they do a lot of things with ritual. They feel that sometimes a child is bad because there's a spiritual thing. I couldn't find anything a little bit further on that. Children in foster care in rural areas also experience a level of higher child abuse that are in sexual abuse that is in foster care, um, which is really just surprising because according to the National Center of Missing Children and Exploited Children, foster children have been identified as being at risk of becoming a victim of commercial and sexual exploitation. These youths are subjected to human trafficking, coercion, and force and fraud, which because when they age out of foster care, unless they have a stable background and somewhere stable to go, um, they fall victim to sexual abuse. Um, for commercial sexual or exploitation, it takes 3 levels in a rural area for them to entice a child or young youth into sexual abuse. Um, Local exploitations by one or a few individuals, small regions of networks involving multiple adults and children try to coerce children into sex trafficking. Large national levels, there's international levels for sex crimes and sex crime networks. So this also um, contributes to the numbers of child sexual abuse. Some of the additional things that we need to know about the rural area of child sexual abuse is the high rate of poverty, the decreased workforce, and the effects of the economic recession and the industrial changes that also contribute to child abuse and sex abuse in the rural area. Um, I also felt that looking at some of the demographics about rural versus urban and child abuse and management resources in the emergency department, there is a difference. Um, there's a basic study that says that child abuse resources in urban and rural ED have fewer resources available to them. Only 62% of EDs are reported in the rural area to have a written child abuse policy. compared to 95% in urban hospitals. Only 35% had in the rural area only had on-site policies and rules that they follow uh, uh, for child abuse, compared to 71% in the urban areas, which I found really just amazing. In the rural area, you might not have a social worker on staff to where you might rely on a nurse or a designated person that deals with child abuse instead of a particular social worker that is staffed with the hospital in a rural area. Um, they have what they call special in the rural area. Some in Oregon, especially, they have what they call specialties that these children that are abused will go see a specialist, a pediatric specialist, instead of a social worker, because the staff is limited in a rural area. Some of the rural areas in the hospitals, they also deal with the genre of sexual abuse from, physical, mental, emotional, and so forth. Yet there is 38% of rural hospitals that lack a policy for guiding a management of child abuse in the ED, which suggests that the cost only one barrier to utilize these resources. So they in the rural area, they really are lacking on a policy to follow for child abuse. There's a national child abuse statistics that says 4 million children are reported to be abused. Child abuse reports involve 7.2 million children. 34 million children receive prevention and post-response services. There is 75.3% of victims that are of neglect. There is 17.2 victims of physical abuse, and is 8.4% of victims of sexual abuse. There is so much more in my presentation, so if you get a chance, if you want to read it, I just found it interesting, which was kind of astounding for me to learn that almost 5 children die every day of child abuse. That's just not acceptable. There's 80% of child fatalities involving at least one parent, which is a really sad state when it comes to a child. The financial costs for child abuse in the United States is $124 billion. And that's just astounding. That is broken up between child health care, adult medical costs, child welfare costs, criminal justice costs. There's just so much of it. Even the medical costs for the children is just astounding. As social workers, what can we do? We can increase the resources and support community-based child prevention activities and get more involved. As social workers, we need to educate our families and communities about child abuse and neglect factors, provide therapy for children and families to reduce harm and abuse and neglect. As social workers, we can teach positive behavioral parenting skills and provide access to health care and social services. I hope you like my presentation. Thank you and have a good night. Oh, and I was going to show you. Let's stop the child abuse. These are all over my wall. Bye.